Let's begin by telling you that government has been asked to change strategies aimed at containing the spread of COVID-19 pandemic and attaining herd immunity for citizens as the virus continues to expose the deficiencies in the Nigerian health system. Health experts gave the charge at a gathering in Lagos where they analyzed containment efforts by government and other challenges facing the sector. Abiola Sholanke tells us more.
It is the 60th birthday celebration of Dr. Eniola Enriosho and his retirement from the Lagos State Civil Service. Mr. Enriosho was the Director of Medical Services and Disease Control at the Lagos State Primary Healthcare Development Board before attaining the compulsory retirement age of 60. The 2-in-1 events gave health practitioners opportunity to pledge their commitment to achieving healthy living for citizens as well as improving primary health care in the state. It's about 2 years since the COVID-19 pandemic ravaged the world and claims millions of lives. Experts gathered here analyzed efforts aimed at containing the virus.
The mainstay of the response now is the vaccination. You know, we have done disease surveillance. We have done social distancing, people using face masks and all that, and we are still advocating that. And we have also mentioned hand washing. But the one that is very key, that is crucial, and that is very effective now is the COVID-19 vaccination. And the government has done a lot, the federal and the state, to ensure that we have a vaccine.
About HIV/AIDS until they were almost tired of hearing it. We have not mobilized enough of the communities to know that these precautions are very important. You see me wearing my face mask as well as a face shield because this is a large population and I'm 71. But I see some elderly people going around in parties, no face mask, even ordinary hand washing. If Nigerians are doing it right.
On the 15th of October, the federal government announced that civil servants will require proof of COVID-19 vaccination or negative PCR test before they being allowed to work. Hence, stakeholders share their views on the issue.
We are dealing with the public and we are representing the government. And the government is advocating that we should give this vaccine. And we know the vaccine is effective. So as civil servants, we are supposed to be laying good example to the general public. That is why I'm 100% in support of that policy. And I don't believe there's any civil servant that will go against it.
There's a lot of disinformation and negative information being put about in the public space. And I think people, both by the example they set in their personal lives and the advocacy that they do on behalf of the system, should encourage the generality of the public to get vaccinated. And if you do not get vaccinated yourself, then you cannot set an example.
It is hoped that as the country intensifies vaccination drive, coupled with arrival of more vaccines, more people will get vaccinated so that Nigeria can rapidly progress towards attaining herd immunity. Abiola Sholanke, TVC News, Lagos.
They're talking about the containment strategy there, and government advised on, to change the containment strategy for COVID-19, and a lot of state governors, starting from Edo State, Ondo State, Kaduna State, they've been telling the civil servants that, look, even federal government saying by the 1st of December, if you don't have your vaccination, you won't be allowed into your offices.
Yes, but the best approach is still to appeal to people. That is even what the WHO recommends. The WHO has not recommended force as a means of sensitizing people on the hazards of this virus. There is no reason to force people. We have not even reached that level in our country where
because we don't have enough. We don't have enough.
Not enough vaccines to go around. And when we say everyone should go and do the test, it's too expensive to do the test for many of our people. Those who can afford it, look, it's not a problem. How many people can afford that? So it's still persuasion, and I still believe that the best way to address this is to follow those biosafety measures that have been put in place. when you're in a public place, keep yourself protected, wash your hands at all times. They are still the cheapest and most effective means. There is no way we can achieve even 100% vaccination, even if we wanted it. We are not going to achieve that. So let's stick to, let's sensitize the people a lot more on how to keep themselves safe. That was what that woman was saying, that she saw the 71-year-old woman. She said she saw people who are above 70s not protected in any way. That's in my view should be the strategy. The sensitization should be on protecting ourselves more.
Mujit?
Yeah, we don't have enough vaccines to go around, and all the vaccines we have cumulatively in the country, most of 90% of which are from donations from UK and US. Let's combined both AstraZeneca and Moderna. They are less than 10 million units of both doses of the vaccine. So, and when you talk about testing too, it's only those who are traveling or those who have a critical need for it. I mean, and those who can afford it that are going for testing. Community testing, unlike when it first started, has been jettisoned by a government, because you can't blame government too. It's quite expensive to undergo this thing. But then primary health care is one of the key items that the government should take seriously, because most people cannot afford the 50,400 for the PCR test, except you are traveling and you must have your ways and means before you want to travel outside of the country, before you want to willingly go for testing.
50K PCR test.
Yeah, 50,400. Then for those...
When you return, the same thing.
Except those who are critically ill and they needed to be sure
evacuated.
They needed to be evacuated, or they needed to be sure what is the cause or the source of ailment before diagnosis. So that's those who, I mean, and even at that, you have to pay for it.
Okay.